Hello, this is Dr. David Greene with the Arizona Pain Network, where we bring you anything and everything educational for pain management. Today the topic is 5 hints that you're dealing with sciatica. So you may not know it, but when you listen to these 5 hints, you may understand that sciatica might not present always out of a textbook. So key hint number 1 is that sciatica does not always involve back pain. It may just involve leg pain, okay? And actually out of the textbook, there's no back pain associated with sciatica. Because here's what happens. This is looking at your spine from the front, okay? Here it is from the side. That's where we're going to look at it. So these are the disc spaces between your vertebrae, all right? And if a disc piece squeezes out, which is shown in red here, I'll give it to you at the angle, then it can pinch on this nerve root coming out right here, okay? And when that happens, this can get inflamed and cause sciatica pain to shoot down your leg. But it may not cause any back pain whatsoever. So a lot of people have no back pain and they think, oh, well, must not be sciatica, my back's supposed to be hurting. And that's not true, all right? So another hint is that you may have a lot of a skip area for sciatica. And what this means is that you may not only might you have no back pain, you might not have any leg pain. It might just be pain in your foot or your calf, okay? It doesn't have to be continuous all the way down from the buttock or down to the foot. It may just be that it's in your calf or on the bottom of your foot. That may be how your sciatica presents. So it may not be similar to how, 10 other people present. It may be that that part of your nerve is being pinched, and that's where the pain or numbness or tingling presents itself, okay? Now the third hint that you might be dealing with sciatica is you may present with a foot drop, meaning that your foot doesn't lift up like it should. So when you walk, your top of your foot may hit the ground. You may have to find yourself lifting up your leg higher to have your foot clear. So a foot drop can often be the first presentation of a sciatica type situation with a disc herniation pushing on a nerve root. Okay, so be cognizant of, if you have that occurring, what it may be. Now, a fourth hint that you may be dealing with sciatica is an unusual presentation of sciatica, and it might be that you have groin pain. And now you're sitting there saying, how would groin pain be associated with sciatica? Well, it's just an unusual presentation. At the L5-S1 area, which is one of the most common areas where you can have a disc herniation pushing on a nerve root, one of the areas of referred pain that you may have is pain into the groin. And you might say, why is my hip bothering me? Or, what is it? And that may be what it's coming from, okay? So the last key hint that you may be dealing with sciatica, not something else, is that sciatica pain is usually positional, okay? If you lay down and you bend your knees and put a pillow under them, say when you're sleeping, that usually helps a lot because it takes tension off of the sciatic nerve. But if you have your legs straight and say you try and bend over and touch your toes, that is going to put tension on the sciatic nerve and it may make your pain skyrocket. So sciatica pain is by and large positional, and it gets worse as you put tension on those. So those are 5 key points that you may be dealing with sciatica. Check out our website at preferredpaincenter.com, and you'll see there's a ton of educational information on pain conditions and treatments. And the Arizona Pain Specialist has 4 locations throughout the valley. They take over 50 insurance plans, and that includes Medicare, Medicaid, workers' comp, self-pay, major medical, personal injury liens, and they all have board-certified, fellowship-trained pain doctors, chiropractors, and acupuncture. Call today at 602-507-6550 to receive the best pain management treatment throughout the greater Phoenix area. I'm Dr. David Greene with the Arizona Pain Network. Your pain stops here.